Rick is a veteran of the health IT world. I've known him for many years. He started off, he was the founder and president of Oceana back in the day. This is electronic medical records in the late 80s. Has done all kinds of different things and is now heavily involved in various roles at the new School of Medicine at UT Austin. But he's hanging out, as you'll see from his app, in Santa Clara, California. And Rick, you have 5 minutes to tell the world about Be Informed.
Thank you, Matthew, for the great introduction, and just dive in. Be Informed covidata provides a set of online and mobile risk assessment tools for use by individuals, families, and groups to manage personal health and safety and decrease the risk of contracting COVID-19. Early in this pandemic, we were a bit stunned as clinicians and technologists that the core tools to manage the pandemic were missing. So to address this, we built a comprehensive enterprise-class tool set to provide healthcare systems, schools, institutions, and essential workforce employers as a solution to manage their group and population risk. We'd hold those tools up against anyone else, but what we found was that every institution wanted to do their own thing. Every tech company, academic team had their own solution, and this led to frustration, low rates of adoption, and a lack of trust and ability to protect personal information. Subsequently, we have a virus now with rapidly increasing case counts, and it's keeping our kids in school at risk and the safety of our essential workforces, our healthcare colleagues, and our families. So we pivoted. And what we did is we built a secure, confidential, and private biosafety tool set for individuals, families, and groups, and it's basically to manage personal and work-related risks. And we modeled it on the successful work by David Weiss and his team at the NBA bubble in Orlando. So to illustrate, there are 4 key components. And let's say I'm a parent, which I am, a 3-year-old child, and I want to keep that child in school. So for those 4 components, the first one is the highest risk to my child is from my wife, myself, or other family members passing disease to her. So we need a simple health assessment tool for individual health risk. And to orient you, at the top of all of our screens, you'll see a health risk assessment. It's a relative risk, and you'll see navigation along the bottom. So this looks at my gender, age, height, weight, BMI, and I can put different things. Let's say I'm a diabetic, I'm on insulin, and you can see my health risk increases if I have metabolic syndrome as well. You can see I have a relatively high risk of COVID. Second, if I or my wife or child feel sick at any point in time, we need a simple way to enter our symptoms to see if we might have COVID-19 or some other condition. So I can enter things such as a mild fever, a cough that's dry, weakness, and you can see it increases my symptom risk. But instead of building a daily symptom checklist, which many of us are using for our kids and such now, we built a tool that applies advanced analytics to clinically calculated differential diagnosis. And this is across the spectrum of pediatric, adult, and geriatric disease. And what we intended to do was not just cover COVID, we cover influenza, URI, otitis media, asthma, allergy, and other disease environmental risks that we're likely to encounter. Third, we need a simple way to assess the risk we incur going about our daily lives, going to school, to the grocery store, to playgrounds, parks, restaurants, and the like. And it needs to be secure, confidential, and private. So these are all the places I've been recently. Let's just select one. And let's say I was at a wedding at this place. I did not wait in line when I was there, but it was indoors. It was not well ventilated. It was crowded. I did not socially distance, but I did wear a mask. And you can see, depending on different types of protection, we have different risk scores associated with that. Fourth, if we wanted to travel, let's say I want to take my daughter to visit her grandmother down in Southern California, we need to assess our travel risk. This is the current overall risk in the US, very high, 3,500 per 100,000, up 31% this week. Here's a risk in Santa Clara County where we are. It's 1,500 per 100,000, and it's up 37% this week. And then San Diego, 2,000 per 100,000, and up 107% this week. So pretty high risk. We have to decide whether we really want to take that trip or not. So these tools are comprehensive. They're clinically driven, and they're built up from the ground up to protect our privacy. We're building the tools we think we should have had before this became a pandemic in the first place. And to that end, I'd like to highlight a few features we've added since being selected for the competition. One, we added a tool for tests and test results. We added a tool for vaccinations. And I think most interestingly, we added something to define asymptomatic risk. It's based on work by Michael Snyder and his team at Stanford, which we had the privilege to work with on an earlier hackathon. And it appears that the elevation of resting heart rate seen 2 to 5 days before COVID symptom onset is one of the best predictors of potential infection, strong indicator for testing. And this is basically my data from today. So we implemented a smartwatch-based heart rate analytics engine and an early warning system for COVID-19 infection. So the way we look at this, COVID-19 is a canary in the coal mine. And the next time we need to be prepared with a whole different mindset and the right tools to be proactive and take control of managing our individual, family, and population risks. And then I'd like to end with a special call out to our fellow competitors, COVID SMS and Fresh EBT. This pandemic has had an unequal and tragic impact on the socioeconomic disadvantage on our country and on our essential workforces. This is critical to understand. COVID SMS and Fresh EBT are addressing critical needs in these communities, and we're honored to be here today and competing with them. We hope we can all work together to solve the problems this disease has created and hopefully provide fundamental change and face what we have to face in the future. Thank you very much. Greatly appreciate it.